sports and recreation nonprofit organization, and we promote that statewide to about 200,000 lives. We're very proud of that. We're also proud to partner with the University of Iowa Healthcare on a series of videos. And today's video subject is about soccer, social distancing, and sports medicine. And I want to let our next presenter introduce himself, and we'll move on.
Thanks, Chuck. So my name is Ryan Kruse. I'm a sports medicine physician at the University of Iowa Sports Medicine Clinic. I'm also a team physician for the Hawkeyes, so one of my main responsibilities is to keep our athletes healthy so that they can compete at the highest level. I'm also a network physician for the U.S. Soccer Federation, as well as a team physician for USA Rugby. In addition to these roles, I teach medical students and learners of all levels at the university, and I'm also involved in numerous research projects looking at ways to help patients when they're injured.
You do a lot of different things, and I know those are tough jobs. But let's get started. I want to have ask you a series of questions, and then we'll move forward. So my first question to you, Ryan, is: are there ways for soccer players to stay in game shape alone, or maybe to practice with other players while keeping a safe distance?
Yeah, so that's a great question, and obviously that's incredibly challenging at this current time with this horrible pandemic and the social distancing requirements that we currently have. I've been asked this question before, and I think there's two ways to look at staying in shape. I think looking at overall fitness and then soccer specific skills. From a fitness standpoint, there are plenty of ways to stay fit outside of playing full field against your friends. I think going for a jog or a run, doing sprints, going for a hike, going for a bike ride, while none of those, particularly pertain to soccer, I think all of those are great ways to stay fit. In order to maintain soccer specific skills, I think that can be a little more challenging. Most soccer athletes are going to have access to a soccer ball. And so I think, using your backyard or the garage or your basement or upstairs level and setting up cones or any other inanimate object. If you don't have those and maybe you're quarantined with 5 or 6 siblings, you can, politely ask them to be the objects if you want. But basically setting up cones or these objects and dribbling a soccer ball, through them, around them in multiple different iterations allows you to, keep the ball on your foot, keep your touch, and keep those skills up.
You mentioned you're a network physician for U.S. Soccer. Tell us a little bit more about what you do in that job. Do you just treat the players when they're injured, or is there more to it than that?
Yeah, so my role with U.S. Soccer, I think, is one of the most rewarding parts of my job, to be honest with you. I played college in soccer, and just being around these athletes and with them in this environment is incredible. I think the role with U.S. Soccer is probably twofold. The vast majority of what I do and what we do as network physicians for U.S. Soccer is to travel with our athletes internationally. Almost all of our trips are international trips. And what's interesting is when we travel with these athletes, not only are we there as physician, but the second we get to the airport and the second we meet the coaches and the staff and the players, you are part of the team. And so, when we're over there, we wake up at the same time as the athletes. We have breakfast with the athletes. We train with the athletes, which, I played college soccer, and by no means was I a national team player. And when I travel with these individuals and train with them, I'm very quickly reminded why I was not a national team player and why they are. So it's a very humbling experience. And then obviously the medical side of things, any sort of sport injury, physical illness, emotional injury or illness that comes up during the trip, we take care of that for the athletes. When we're back in the U.S., if I'm, here in Iowa and there's an athlete on a trip that gets injured who's from the Iowa area, when they come back, oftentimes there'll be a transfer of care to me to continue managing them in an attempt to, like I said, get them back on the field.
Travel must be exciting and fun. Do you think being an athlete can be an advantage for a young person who wants to go into medicine?
Yeah, I do. So I think there's a significant amount of overlap between being an athlete and being a medical professional, specifically a physician. You know, for an athlete to master their craft, it takes hours upon months upon years to, to really refine their skill set and their craft. And I think you have to have a significant amount of, mental fortitude and determination and concentration to become an athlete or a high level athlete. And I think those skills carry over nicely to the study of medicine. Similarly, it takes hours upon months upon years to get to the level of a physician. And I think the mindset and the skills that I mentioned for these high level athletes, I think go quite nicely in the pursuit of becoming a physician.
Great answer. And last question for you, Ryan. You said something interesting about your work as a sports medicine doctor. You help people heal from injuries, but without having surgery. Tell us more about how you do that.
Yeah, so I think with injuries, there are definitely indications where injury X needs surgery Y. I mean, there's no way around that. However, as medicine has advanced, there are multiple options now to take care of some of these injuries non-surgically, when historically they probably would have been managed surgically. One of my passions and what I do quite a bit of is the field of regenerative medicine, where basically we use the body's innate healing capacity, the body's healing cells, to help the body do its job better. Basically, we take these cells from our athletes and from our patients, and using a machine called an ultrasound allows us to put these healing cells directly into the area of injury to help re-stimulate and help the body heal that tissue when it probably would not have otherwise.
Thank you very much today. That was very valuable information. Let's get some key takeaways. Social distancing doesn't mean that you can't still improve your skills. Soccer specific skills can be practiced in a yard, garage, or basement using cones or other objects. Fitness can be maintained with a combination of running, hiking, biking, and walking. Number two, there are plenty of opportunities for doctors to get involved in sports. If you're an athlete and you're interested in medical school, use that same passion and drive to master your sport and your studies. For fitness and wellness advice and challenges, visit livehealthyiowa.org. Again, thank you to the University of Iowa Healthcare and to Ryan, and great answers today. Everybody have a great day, and let's get active out in the yard with soccer.
Thank you.